Yeah, so there's been lots of talk of people are saying, I think we've already had this. We already came through our community. And even me, I was like, okay, well, I've been sick or other people have been sick and it spread around in the camp and whatever. But I didn't really realize how serious this was in that because lots of people are like, all right, so Canada's quarantined because they want to get the pipelines through and they don't want the Indians acting up, right? So there's lots of people amongst us who are thinking that.
Yeah.
People aren't taking this that serious.
Yeah.
And it's starting. People are starting to take it serious, but in kind of funny ways. So there's been like the elected band councils have been sort of like, okay, we're going to shut things down. Everybody stay home. They can work from there, or we're going to close this or that office. The problem is they've got a flow of money coming in from the federal government, so they can do that, and it does not affecting those people's ability to eat or pay their bills. Yeah. But we've got tons of the majority of people that are working in our communities are working in community, like in individually owned businesses. Yeah. That if those businesses close, those people that are working in those businesses, there's no paycheck. And most of them are working for cash. So they're not going to get access to EI.
Yeah. So let me throw a few thoughts in there because you put out some interesting concepts and ideas. So first off, what I'm going to say is going to sound scary to a lot of people, right? And particularly your people, it should sound scary because you guys went through probably the single worst, consequences of a pandemic in the world's history, right? The Indigenous people, Ongwahome of the Americas, 95% were killed not by superior weapons or anything else, but by disease, right? It created a blank sheet. It killed so many people that I won't get into the details. You guys know your history, right? So how to put this? It's serious. It's very serious. You hear, well, it's not much worse than the flu. Maybe 1% of people are going to get off by it. That's pretty good odds, right? 99% are left. The thing that worries me about Ongwahome people in your community is that this disease kills your elders. It kills your language keepers. It kills your knowledge holders. And that's a really, really heavy thing for you guys. In white society, I love my parents. We love our grandparents, but those folks, sitting in old folks' homes in the white community are not people that are looked up to by the rest of society. They're not necessarily people that we look towards with reverence or, that we hold up in terms of looking for guidance from in the way that your communities do. And so I think there's a unique tragedy to this disease running through your communities. So I'll break some numbers down for you. So, we heard that 1% idea, right? So that's not how it breaks down through the generations. So if you're over 80, my numbers are going to be slightly off here, but I hope the point gets through. So if you're over 80, stats are around 20% of those folks who contract the disease will die. In your 70s, it's probably somewhere more like 12%. In your 60s, 6%, and it goes on down the line. Thank God this doesn't hurt kids, okay? But people who are between their 20s and 40s shouldn't be complacent because data out of the CDC, the Center for Disease Control in the States, is showing that 12% of ICU beds are being occupied by basically millennials, right? 20 to 44-year-olds. So this is a really serious illness, okay? It's not it kills you by drowning you in your own body fluids. So it triggers an inflammatory response in your lungs, all those tiny little air sacs, those little grape sacs fill with fluid, and you drown. So it's horrible. It's a serious illness. Okay. In terms of what to expect, 80% of people are going to have a cold, a cough, and that's going to feel just like any other cold and cough or flu, right? That's the sneaky thing about this virus is it's a great imitator. So when you said, a lot of my people say that, well, we had that back in December. The symptoms are very similar, particularly the mild symptoms. So that 80% of mild symptoms, right? Then you got 15% who get pretty sick, okay? And their lungs start filling up with some fluid. And if they don't get some oxygen, then they can get in trouble. They can die. Okay. So they need to go to hospital. They need to get, nasal oxygen or a mask and be given what's called supplementary oxygen. So that's 15%. And I worry about those 15% because if they don't get oxygen, they might not do well. They might die.
So would
And then hold on, then you got your 5% that are left, right? And these 5% are critically ill and they need to go on a ventilator. So a machine that pumps air in and out of their lungs through a tube that goes down through their vocal cords into their lungs. And they need to be on that machine often for what they say an average of about 2 weeks. So if you think about averages, that means some people are on less time, some people are on even more time. And there are 3,170 ventilators in the country, and they are close to 100% occupied. We're freeing them up as much as possible. We're trying to buy some new ventilators. We're going to use the operating room breathing machines as ventilators. But, that capacity, that's why you hear people keep saying flatten the curve, flatten the curve. If too many people get sick too fast, then us guys in healthcare, we're not able to be there to care for y'all and to run these machines and have enough machines to look after people. Okay, so just to summarize that, this is not the flu. It's going to be uniquely horrible for Ongohoe people because it's going to take out your language keepers and your knowledge keepers.
You said something that was important that I want to ask a question about. Those people that don't need the first stage of ventilation, the first stage of oxygen, the ones that get some fluid in their lungs. What happens if they don't get access to that oxygen?
They're teetering, right? Like we don't admit people to hospital that don't need to be in hospital. So we admit them to get that oxygen therapy. So, if they don't get it, they get sicker potentially, right? Maybe they'd be able to struggle at home and breathe through it, but a big part of those folks probably wouldn't make it.
Okay, that's something that's important to know. It's important to be said so people are aware of that.
Yeah. And the other thing as well, we talked about it affecting the old. I don't mean to just lay bad news on top of bad news, but it affects people who have other illnesses, right? So if you're a diabetic, if you're a smoker, if you have heart disease, all these things put you at a higher risk as well, right? So the natural kind of reaction in the face of getting a bunch of shitty bad news is often what's the word, like denial or. Right. And you say, oh, fuck, I don't know. I heard something went through the community a couple months ago. We almost have got it. We're strong people. Water off a duck's back. I guarantee you, if that was coronavirus that moved through, then you would have lost countless people. Okay. So that's not, that's the thing. The mild symptoms of this, the people who get the mild version, it looks like a cough or a cold. Okay. But the people who get it, the elders who get it, the people who have a few health conditions that get it, they get really sick and some of them die.
Okay, that's good to know. So I want to know about this fluid on the lungs. So if someone because my people don't go into hospitals. We don't go there whining because they got a flu or they got a cold or they got a sniffle or they got a sore throat. Not usually.
Yeah.
So because, there's a whole myriad of reasons why, but we just generally don't do it. We don't run there constantly. And many of us don't have home doctors.
Yeah.
So we don't have someone to call to go check up on. So we home remedy or we suffer through it. Yeah. So I need to know about the symptoms, about when the hospital thing, about what fluid in the lungs is, because I want to make sure that it's not just you're coughing up a bit of phlegm.
Yeah, no, generally you're not coughing up phlegm. It's usually described as a dry cough.
Okay.
Dry cough and breathlessness are the biggest things, right? And so breathlessness means, it's kind of like you feel out of shape, like crazy out of shape all of a sudden.
Yeah.
Right. So if you usually walk up the stairs and maybe you huff a bit at the top, if you're kind of halfway up and, I gotta grab this handrail, gotta stop for a second, catch a breather, that's a very worrisome symptom.
Okay.
And that's what people are describing. And that's sort of when you get worse, that's what you're noticing. You read reports all over the place. Some people talk about trying to hold your breath and see how long you can hold your breath for being some kind of a marker. The reality is you need to be seen by a healthcare practitioner or a clinician who can assess you and get a sense of things. They can see what your respiratory rate is. They can put a little sensor on your finger and see where your oxygen levels are, right? It's a complicated thing assessing who's really sick, who's mildly sick, who's not sick. There's some common sense to that. Like right now, I'm not sick, but especially with this disease, if you've got a bunch of other health conditions, sorting the wheat from the chaff there requires someone with some training, right? Unless you're on either end of that spectrum, being perfectly well, or if you're on death's door, then we all know, right? If you're on those extremes. But yeah, it is tricky because it's like, well, a lot of patients I'm seeing right now, we don't have the testing capacity to test everybody. So I'm seeing people that probably are COVID, which is the SARS-2 coronavirus disease. So when I say COVID, that's what I'm meaning there. So I'm seeing people. I guarantee you, I've already seen people that have COVID, and most of them again are going to be okay, especially the young ones. And so it's an assessment I make when I see them in the hospital. How sick are you right now? Okay, we don't have enough room to bring everybody in who has this disease, even if it's mild. If it starts getting moderate, then yeah, we got to make a call. Then we do a few more tests. We decide, we do a chest x-ray, that kind of thing. And the severe ones come in for sure. But I send a lot of people home who I'm pretty confident have COVID. And I say, hey, if it gets worse, come back. And that's what I'm telling them to watch out for, is really that breathlessness. Other symptoms that can come along with it, typically you don't get the runny nose as much. Sometimes people describe a sore throat, body aches, and there's a small subset of people that get vomiting, diarrhea, that kind of thing. But yeah, the big one is a dry cough and breathlessness.
How long does this sickness last?
So the sneaky thing about it is that the average incubation phase is about 6 days. So from when you get exposed to the virus building up in your body enough to cause disease, but that can go up to 2 weeks. And that's why you keep hearing, okay, people coming back from other countries, they need to be in strict self-isolation for 2 weeks because they may not even start to generate symptoms until that point.
Right.
Okay. When you get sick, I think the data I have is more on the critically ill folks, but if you get sick, you get put on a ventilator. People are on a ventilator an average of 2 weeks, which is an insanely long time to be on life support. Okay. And that's the average. Some people go longer. So month. And again, the people who get it in a real mild way, some people, small subsegment, don't even know they're sick. Other folks, kind of mild cough, cold, a week or two. And some people, it can drag on for a month, 6 weeks. There's some variability there.
Okay. So does wearing a mask, like maybe going out in public or interacting with others, help?
So, there's different kinds of masks, right? Your basic surgical mask. If you are sick, that is a very good thing to wear because it keeps things inside, right? Ideally,
spreading it.
Exactly. Yeah.
Okay.
Ideally, and that's why, it's part of Asian culture. We just don't see it here. Like if you go into the city or whatever and you see, independent of this disease, you see, there's an Asian person there wearing a mask. And that's just kind of part of their cultural practice a lot of the time, probably because they live in very crowded places. And it helps keep whatever illness you've got a bit in, right? Because this disease spreads mostly through what we call droplets. So when you cough or sneeze, you're sending out these tiny little water droplets, and they travel about up to 2 meters and then just gravity, they're water, so they fall to the floor. Okay. And so that's why there's that recommendation of try and kind of keep 2 meters from other people. Okay. The mask can help contain it a little bit. Still, if someone's wearing a mask, still you want to try and stay 2 meters away. I held a workshop yesterday and I set up all the chairs in a big circle about 2 meters apart, right? Just the thing to do in this setting is to assume you have the disease and act accordingly, right? So you're assuming you've got it. You don't want to spread it to your elder. You also don't want to spread it to your son or your nephew, because who knows, they might go and see grandpa, right? So it's a tricky thing.
Okay. And
I think just to interrupt, I think the challenge is like it's easy, I think, just to kind of, when you hear this information, you're like, well, we're all fucked. What are we going to do, right? And just become complacent or, and I think, again, in your people's scenario, that's not an option, because you guys need to protect those elders. That needs to be the motivation. If you're trying to motivate people to take it seriously and wash their hands properly and what we call socially distancing, staying 2 meters away from people. If you are sick, staying at home, really ideally just staying in your room. Okay. Try not to share a bathroom. That's not easy in terms of the housing conditions you guys have, right? But every little thing that all of us does can slow this thing down. Okay. Such that, and that's the whole, you've probably heard this flatten the curve thing. We want to slow it down. enough that our health system can cope with the numbers of sick people coming in.
Right. But you don't have anywhere near the capacity to actually handle it, even if you slow it down, truthfully. You don't have it.
Truthfully, yeah, I think I might have said this already, but we have 3,170 ICU beds in the country.
Yeah. There's 32 million people.
If you do the math, if 1 million people get sick at once, 5%, that's 50,000 people that need an ICU bed. We have, shy of 3,200. So if that 1 million people can get sick over a very extended period of time, then yeah, we'll be able to keep the lid on things. And there's ingenuity here. People are constantly, the more time that you give us by not being dumb and by socially distancing and wearing that mask if you're sick or isolating by yourself, the more time that you do that for, the more time it buys us to come up with cool ideas and things. So I've got friends who are, 3D printing medical devices, right? And trying to build more ventilators or, finding new treatments that might make this disease, might not cure it, but might make it not last, 2 weeks on the ventilator, 1 week on the ventilator. So those things, the more time that the public gives healthcare workers to learn about this and best practices, the more chance we have to save, as many people as we can.
Right.
I mean, so in terms of, I've been out to Kanenhariyo a few times. I used to live on the border with Six Nations. I'm not an expert in your guys' ways, but I do know a little bit about your communities, and I think a little bit about what your healthcare situation is like. And so I'm just thinking off the cuff here, but the most important thing for you guys to do, I think, is to get your elders away from the danger. And that probably means getting them in some separate housing, not all cramped together, but, rather than you guys trying to quarantine the sick and keep the sick on lockdown, you need to keep the elders who are healthy and who don't have the disease yet from getting it. So you probably need to get them into some kind of like protective custody, we'd even call it, right?
Yeah.
Right. And then you need to figure out a support system to help them get their basic needs met, right? Hopefully they got running water and they can turn the water on and off. I know that's not a guarantee some places. But delivering.
We have lots of water that's not actually, you can't drink it.
Yeah.
So I would suggest most places have running water,
yeah,
but not potable water.
Yeah. So what I was saying is you got to get those folks on this language isn't, what did I just say? Protective custody. Okay.
Yeah.
And then you got to bring them food and water and the bare necessities that they need for months. And you got to do that in a way that the people who bring it are not getting them sick. Right. And that involves really meticulous hygiene. So, and putting a lot of thought to, again, as the person who is delivering that food or water, even if you don't feel sick, you need to be in the mentality, I am sick, my hands could be dirty. And so you're washing your hands, you're putting gloves on, you're getting those groceries very carefully.
Probably wearing a mask.
While wearing a mask, you're delivering that bag very carefully. We're going to give you information on how long these viruses can live on various surfaces so that you can develop some protocols about how to do that, how to keep your elders safe. And I think, my job, I think a lot about triage and that's how to help the people who are most vulnerable, put the resources for the most vulnerable people, kind of battlefield triage. When you have limited resources, you got to steer those towards the people who are salvageable, who most need it, who are the most valuable. Yeah. And in that case, it's your elders. And I think just focusing on that as a mission is going to be more than enough work. So I wouldn't divide your labors in terms of, okay, how can we set up this oxygen tank here and this there? In terms of, my perspective as a healthcare worker and knowing kind of what needs to be done when people get sick, you're not going to be able to build that capacity in the time that you have to adapt. What I think your focus needs to be is, get those elders on in a safe place, and develop protocols to meet their basic needs and help them, camp out until a vaccine is developed or better treatments are available. That's priority number one in my mind, knowing what I know.
Basically we have a new disease amongst humans that will kill us.
Yeah.
It's not going away. It's not, there's no protocol to be like, well, in 3 months from now,
we're
isolated enough and this thing is gone and we don't need to think about it anymore.
Yeah, I mean, the government and the media have been sort of drip feeding, I think, because they're afraid people are panic and, they don't want to scare the economy too much, but if if you're serious and you're researching this stuff, this no one has seen this virus before. So unless unless we were able to fully contain it and do things like China has done, where they've put their society on lockdown, they've welded people into apartment buildings. They just welded the door shut. No one's coming out of this building. They shut down all the roads and the rail. If you got sick, they put you in a hotel room. They locked you in that room. They'd bring you room service. You had that bathroom, that bed. You didn't leave until you were better, right? They did such aggressive, people would call it draconian or authoritarian things to contain the virus, and they largely have. It got out of China, obviously, but in China, new cases are dropped into the single digits. Taiwan, Singapore, these other countries that were able to really organize themselves could do that. But, in the West, it's been, I would call it draconian incompetence or draconian indifference, and it hasn't been contained, and it is circulating. It's out there. I'm seeing it every day in the emergency department. And we're getting our first sick cases right now. People who are getting put on life support. There was a doctor I know in Toronto, and his father-in-law just died in a week's time from getting sick to dying in the ICU. Right, and that's the father-in-law of a doctor in Toronto that I know. I'm not sure what's going on in Kanenhariyo in terms of if people are getting tested. Like you're saying, people don't like going to the doctor for a whole variety of historical reasons. And so you guys aren't getting tested, so you have no idea what's going on in the community right now and who's exposed. But I can pretty much guarantee you that there are people on res who have it right now. And as a result, you guys need to take kind of maximum precautions to not be spreading it around amongst anybody, but particularly not be spreading it to your elders. So if you have, a teenage son and they're like, well, I don't care, I'm young, I'll be fine. You just have to remind them, what you do, your actions right now, they can determine whether this elder lives or dies. Honestly, it's that serious.
So Chris, can you just say a little bit about the kind of, like what we're seeing is that businesses are being shut down, the restaurants are being shut down. In some communities, they're shutting down tobacco stores or cannabis stores. And that's obviously going to cause a lot of economic disruption. Is there a way that that stores can continue to operate? And if so, what kind of a protocol should they be following in terms of their customer service?
Yeah, so it's a tricky question to answer because, if everyone could just lock down and hide in their house for a month, if everyone did that perfectly, which is not going to happen, but then the virus needs humans. It only lives in humans, in our lung cells and our other cells. If it's denied that and it's unable to spread to the next person, the cycle of infection ends and the disease is gone. So the ideal thing would be if you could get rid of all economic considerations and not need to have money and spend money and buy things and you had your house stocked up that you could just hole up for a month. That would be the ideal thing. That's would be amazing for me as a healthcare worker, because then we'd flatten that curve and we wouldn't get overwhelmed and we wouldn't have to make horrible decisions about 3 very deserving people and which one of them we're going to save and which the other 2 we're going to have to let die. I think a big issue, I think Seth, you're mentioning this before, is that it's a cash economy, right? Cash is filthy. It's going to be covered in the virus, right? I took some cash out of the bank, not really thinking a couple of weeks ago, because I'm like, hey, if there's a natural disaster or a catastrophe, it's good to have some cash on hand. And then I realized, yeah, this is it's got some value, but big discount on that value, because anyone who's smart shouldn't be using it.
Yeah.
And a lot of stores are saying, nope, tap only, right? So in terms of businesses staying open, in terms of how do they do it in China, some of the examples I've seen, there'll be a restaurant, it's takeout only, there's no dining in. The workforce, the manager, enforces that if you're sick, you do not come to work. You get your temperature checked when you get there. You get your temperature checked 2 or 3 times a day by the manager. The manager as well gets their temperature checked. Very hygienic processes are used, proper hand washing, people wearing masks, that kind of thing. Food is prepared, and then either delivered or, for pickup. And in China, they will actually take the temperature of the person who made your food, and that's on your receipt, as well as the temperature of the person who delivered your food, and that's on your receipt.
Oh, that's awesome.
Yeah, so they're organized, right? Like they're smart, disciplined, organized people that were able to you get these systems working lightning fast, and that's why they had 70,000-80,000 cases, and there were days when they had thousands and thousands of new cases every day, and now they're down to, I didn't read the most recent stats, but I heard there was a day they had no new cases recently, right? They've been able to lock it down. We're just not a functional enough, organized enough society to have done those things, and as a result, the cat's out of the bag, and we're not getting it back in. And I think what I was trying to say before, I know this is a bit of a run-on, but the disease, no one has immunity to this disease, so unless you contain it, it's going to spread. It's already spreading now. And then basically, how does this disease come to an end? We develop immunity to it. We do that either by getting a vaccine or by just getting the disease. And if you run the math on that, if we just do it by just getting the disease, then a lot of people die, right?
We can't afford that.
We can't afford that, right? So I'm not great at doing math off the top of my head, but if 1 million people get it, if you accept that 1% mortality, that's 10,000 that die, right? And that's if there's good healthcare, right? That's 50,000 that need a ventilator, and if there's not those ventilators, that's 50,000 that die. So the numbers are pretty scary. So like, what can you do as an individual? Wash your hands. If you're sick, stick to yourself, and just basically stick to yourself anyway. Assume you're sick, and just, it's kind of like make a game of it. Just, I need to not touch things. I need to not, you kind of need to be OCD right now.
If there's somebody who's figuring out how to make, like, printing ventilator machines or parts or whatever, those sort of stuff, we need to have that information. We can get all of the whatever sort of like material or equipment that's needed to be able to do those sort of things. I'll be quick, straightforward with you, Chris. I have no confidence that the Canadian medical system will protect us. So we need to figure out, by talking to people like yourself, what strategies and what we can do to protect ourselves.
Yeah.
What steps that we have to take.
Yeah.
Because if it's something that's this isn't going away, then we need to, then we're like the Chinese. We're actually much more effective at getting things fucking organized and done than the society around us. And we'll figure out the systems and protocols to make that happen. There's a reason why we're still alive after 300 years of people trying to wipe us out, and it's because we're good at staying alive.
Yeah.
So I'm asking questions, and I understand you not being optimistic that we'll get it done, but that's because you don't know who we are.
Yeah. It's not that I'm not optimistic. I think you guys face enormous challenges. It's not that I discount your guys' survival spirit, right? I think, giving this thought, priority number 1 is get your elders somewhere safe.
Yeah.
Okay. Priority number 2 is keep them safe. Get them the basic needs, their food, their clothing, their shelter, their water, in such a way.
What you're telling me is that we got to get our people from about age 50 and up safe.
Really, I mean, the highest yield I'd say is 70 and up is people you really need to worry about.
But our mortality rate's way lower than yours.
What's that?
Our mortality rate is much lower than yours.
Your people don't live as long. Yeah, your life expectancy is lower. Yeah.
So our old people are younger than your old people.
You could look at it that way. Yeah.
So it might be 70s, but I'm thinking that's 60s.
Yeah. Yeah. It's a fair way to look at it.
I don't want to give anybody the misconception that, I'm good, I'm old enough, I'm still young.
Yeah.
When we take things into consideration about what the age discrepancies are.
Yeah.
So what about oxygen? Like, where does the canisters of oxygen come from? Or are you guys, do the hospitals like fill their own tanks? Is there like filtered sort of like pump system? Is that how it's being done, or what?
I have no idea. The tank's just there. It's these kind of supply chain questions are all of a sudden very relevant. You don't think about a supply chain until it's interrupted or there's not enough of it.
Right.
I'll tell you, Wuhan, China, where the outbreak was, they ran out of oxygen.
Mm-hmm.
Right. And you, like, as a doctor, you hear that and you're like, what? Because you think, oxygen's in the air around you, but no, those tanks, there's some laws of thermodynamics and concentrate. You got to get, pure oxygen into a tank. There are machines that do it. I've seen it when I used to do palliative care. They'll give people who are dying of disease and they can't get enough oxygen just to keep them comfortable. They get them a machine that concentrates it, but very expensive, doesn't make a lot of oxygen, right? So I honestly, I can't answer that question for you.
Well, that's a question I'll be looking to find out.
Yeah.
So back to masks. So they're helpful in terms of people wearing them so you're not spreading stuff.
Yeah.
And are they also helpful in terms of, I've read this about helping people to not like touch their eyes and their face and that sort of stuff? And
I wear a mask. I don't wear a mask when I'm out and about on town. I wear a mask when I'm working in the hospital, mostly for that reason. Yeah. Cause I don't touch my face. I've got a set of like, squash goggles or just like eye protection, just so I don't touch my eye. Right.
Yeah.
So those are things, but yeah, the most effective thing in terms of the general public, why you should use a mask is if you are sick, to keep it on the inside. And, there's a big frustration amongst healthcare workers. We see a lot of people in the general public wearing what's called an N95 respirator, those white masks, those thick white masks. And they are not doing much of anything for the general public. And if we don't have those and we're needing to put people on life support and ventilate them and things like that, if we run out of those as doctors, then we're all sick.
Why?
And,
what does that do for you? How does that help you?
So in the setting of what we call an aerosolizing procedure, so like when I put someone on life support and put a breathing tube down their throat,
yeah,
the patient coughs and brings up a lot of viral particles basically, and really contaminates the room. And so having that specific mask in that specific setting is very important. And if I don't have that mask in that setting, then I'm contaminated and I'm getting sick, right?
Mm-hmm.
And if I'm sick, then there's no one to operate that ventilator. There's no one to assess you, no one to take care of you.
So in the event that we have to run a field hospital, because it's possible that we might wind up in that situation, it would be wise for us to have those for those people that we may be leaning on to help us to keep our old people alive, but not mass amounts to be spread amongst everybody.
Oh, you say to have masks? Is that what you mean?
Oh no, yeah.
I think having they're called surgical masks, like the thin blue masks. Yeah, that'd be a good thing to have in your community for people who are sick to wear them. If people are getting tested.
What I'm concerned about are the support people that are going to be doing support for the sick people.
Yeah.
Support for the non-sick elderly and those that we're trying to save. About the people that are going to be providing support for those two parties.
Yeah.
How do I protect them? That's what I want.
I think what you're asking is like, so you got an elder in a safe place. Yeah. Safe place means they're not living with other people, especially young people. They have their own bathroom to themselves. Maybe it's a couple or something, right? They're holed up in a little house. They got their own bathroom. No one else comes into that house, right? So the person who's coming to deliver them food, water, other essentials, how do they not, even if they're not feeling sick, you have to you just assume you are sick, even if you feel great, because that's the way this virus works. A lot of people will be asymptomatic, or even before they get sick, they'll be spreading that disease around. So that person would need to be very careful in terms of going and getting the groceries. So, probably wearing a mask would be good so they don't touch their face.
Yeah.
Washing their hands, and I'll send you guys a video on how to do that. It's very particular. I do it for you right now. It's palms, webs, back webs, knuckles, thumbs, tips, wrist, right? It takes about 15-20 seconds. It's like a surgical scrub. That's what we do before we go into the operating room. Yeah. That's the kind of way you need to wash your hands now, especially that person. Okay, you find the most responsible people, not a dumbass teenager or something like that. You find a very responsible person who can memorize how to do that kind of thing and how to just handle themselves when they go out shopping. They'll wash their hands, put some gloves on, they'll get those items, put it in a bag, and then they will, put that in the car, take it up to the elder. They'll, the elder, that house should be stocked with some wipes and things like that, some antiviral wipes. That person who's dropping the food off probably shouldn't handle the door handle, just knock on the door, give them a call. Hey, we've left some food for you at the end of the driveway or whatever, back porch. leave, and then the elder would come out, get that, and the elder would know a little bit as well about how to handle that, right? So assuming that the bag is contaminated and wiping things down a little bit, right? Soap and water is just as good as sanitizer, right? It's just, it's hard to carry that stuff around with you.
Oh, really? It is. It's just as
Yeah,
good.
soap is great. Yeah, these viruses, they're encapsulated in like a tiny bit of like droplet of fat, and what soap does is it breaks that apart, so it kills the
Oh,
virus. Yeah, so
okay, that's great to know.
you don't need fancy hand sanitizer. You should have some, because it's, you know, in the middle of nowhere, halfway through the grocery store, you touch your face and you go, oh, shit. Then you want the hand sanitizer because you have it there, right? But you know, at home, hand washing with soap and water. Yeah. So I'm just trying to kind of off the cuff come up with some sort of protocols for how you do this. So yeah, get your elders into, so not all the elders into one building, right? But scatter them, get them into like their own housing on their own, and then develop
Might
protocols.
be possible for us to take over a hotel.
Yeah. Yeah. That's not a bad idea. Yeah. Because that's kind of the reverse of the way that you think about it, is you quarantine the sick people. But if you quarantine the healthy people, I mean, people who are still healthy, those elders, that's a possibility. It's just, it's scary thinking about how long that has to go on for. But yeah, that probably makes more sense than, you know, you guys already have a housing crisis on the reserve where you're going to find a bunch of empty houses to kick everyone out and put elders in.
Yeah, you won't find it. So okay, that's good to know. I was one of those people that wasn't taking this too seriously, and
Yeah.
I recognize that it needs to be taken ultra seriously,
Yeah.
and we figure out solutions. And I'm concerned. And we don't. And when they said, you know, close the schools down for an extra 2 weeks, I think that kind of gave people a silly impression that this will blow over like SARS did, or like one of those sort of things.
This is different. This is once in a century, right? We saw the Spanish flu 1918, right?
Yeah.
Between 50 and 100 million people around the world. It spread around the whole world. It started in Wichita, Kansas, I believe, and then it shipped out with soldiers to Europe, landed in France, started wiping people out there. It's called the Spanish flu because it spread into Spain, and there was no Spain was neutral during that war, so they didn't censor their press as much, and so that was where the first reports came out.
Yeah.
Across the front lines, across the trenches, killed a bunch of Germans. They may have lost the war because so many of them got sick right at the moment that they're doing a big offensive. And then it spread on the shipping routes to all the ports all around the world. And yeah, I mean, even remote indigenous communities up north, Turtle Island, it visited those places too, right? So no one has memory. No one's lived long enough to remember. You know, you're a historian. You know your history, but no one has lived experience. No one's 140 years old to be able to tell those stories. But I understand you as someone who pays attention to those stories. You were telling me a story earlier about what happened in those times.
Yeah. Yeah, they use the island and Telegraph Narrows, one of the islands there, and they had rowboats they set aside, and they brought food to the people, and they rowed over and got their own food and rowed back. And if they were too sick to row, they died.
Yeah.
And they sent them over as sick people came along. They isolated them on the island. That's what they did.
Yeah.
Yeah, and that was that hurt us. And
yeah.
But this one seems to be more aggressive than that one in terms of its spread.
It has, Spanish flu was, I think they say 1% to 2% mortality rate, so pretty similar. But the thing is, it killed young people. So 20 to 40-year-olds are the main people it took.
Yeah.
And the reason it did that is because their immune systems, sometimes it's your own immune system's response that kills you, because it's that inflammation, and they would get overinflamed, fill their lungs with fluids, and drown.
Right.
This one, it's gentler on, thank God, on the babies, on the young people. But as you move up through the age groups, and the more medical problems you have, the more serious it gets. So it's different.
And
can you imagine if this did, say it was the opposite, right? And this one it killed 20% of kids under 3 years old. What would you do? And what would your community do? What would your parents do to keep those kids safe? You do everything you could, right?
Yeah.
You put them in a bubble. And that's what you guys need to do with your elders, in my opinion. Just flip those age groups around, and yeah.
Yeah. All right. Well, I got work to do, so I'll talk to you later.
Yeah.